Hi there. This video is a brief introduction to how our systems will change the way you manage and file your results. So if I come now to review some results, the first thing I'm going to do is check for this blue arrow icon on the right hand side. If I can see that, it means that the auto review rules in System 1 have been applied. If there are some where that's not been done, before I do anything else, I'll click this Apply Auto Review Rules button. That would bring up a list of names of results that haven't been checked yet. You would click yes, I want those to be done. Probably go and grab a drink because it takes a little while. And then when you come back, you'd find quite a lot of results are grayed out because they've been filed. You'd also see they're a lot like this one here. And I may need to pause it because it seems to be taking an age to retrieve while I'm trying to record. Now I'm in the result, I can see the usernames, but not all the other battery headers. And that's because 4 of them have been filed already. And in these, I can see, for example, review not applicable, set by auto review rules, satisfactory. I can look at those if I want to, but the only one that's outstanding is this one here. Now, if you've got it enabled, we will often be filing usernames. The auto review rules will often do that. But because it's sometimes not clear why they haven't, we've added on this button here. You may be able to see it's a test tube with some numbers. If this appears, it means there's some kind of sort of filing guidance available. And here it's telling me that it's not been auto-filed, or maybe by admin staff, because it's dropped more than 10% in the last 18 months. And the drop since the highest is 23%. Now, say it dropped from, I don't know, 63 to 58 in the last 18 months, then it would show actions here. It might be, for example, that it's going to repeat 3 months later to potentially confirm or rule out a CKD diagnosis. But here it's telling me there are no actions identified, and so to use clinical judgment. So I might be looking at this graph here to see whether I want to do anything else with that result. I can also click on further info, and this will display for me a bit more information like current CKD coding stage and relevant results and things. And if there were other actions that were picked up, it would display here. I'm just going to pause at this point and then show you on a test patient some of the kinds of actions that you might also then get coming your way. So we're here now on a test patient, and this is our pathology overview screen. I can access it from the demographics alerts using this button here with the green graph and red icon. Now it doesn't always work brilliantly well on test patients because, like here, you can see it's flagging that these results are not attached to pathology results. I've just coded them to demonstrate a few things. It will hopefully be a bit more useful and a bit clearer on real patients. But it might be that you, say, get a task asking you to review a particular result. And what you would do is you would come to the relevant page. So, for example, here, we've got a wage team clinician review, CKD may need referral, and then a bit more detail, consider referral to nephrology due to KFRE more than 5. You may not be that familiar with KFRE. Some parts of the country using it lots, some less so. Wherever you see these 3 stars, that means if I right-click an action and it will perhaps give me some useful information. So in this scenario, it's taken me to the sort of referral criteria, and KFRE greater than 5 is there. For all of these pages, the idea is that on the left, you've got the kind of relevant and useful information for the patient. So recent results, relevant medication, repeats. It varies a bit page to page. And then on the right, you've got ways to record the outcomes. And the easiest way generally to do this is to drop down here, and you would pick what the action was. So it might be that you've discussed it with the patient. It may be that you've referred them to nephrology. Maybe they've declined it, or it might even be not made due to clinical decision. And you then put some notes in here. I don't know, due to age and frailty or something. That would then take them off our list to review. And also it would show next time in here, in fact, I can probably show you that, that's the outcome that was recorded. So if, say, a year later, the patients had the same results and a similar outcome, you can see there what's been done previously. Other pages have got different information and different actions. So this particular one is saying the patient has completed a questionnaire to increase their statin dose, and we've actually got a button separately for that to titrate or change the statin therapy. But again, you might review it and there might be other outcomes that you'd want to record. This is currently grayed out because I've just been doing this other outcome here. that won't often be the case, and it might be we can find a way around that. But again, I can see the previous kind of outcomes here. I can see the questionnaire that was completed by me for the patient to demonstrate this. And as well as the kind of normal sorts of things, I've got options like declined or admin actions as well. For each thing that might come your way, you might be getting a task, you might get a patient booked in with you. The idea is that this template will show you what needs doing or what to consider doing. It's up to you, you're the clinician, and it will give you ways to record it. And whenever you kind of pick anything from here and record an outcome, that will effectively kind of close off that pathway and that element of care, at least from our system's points of view. We'll provide, and there are more detailed information about different kind of pathways and so on, but we're trying to build it in a way that it works much the same for each result. So if you can get used to it for one result, it shouldn't be a great big shock to then start using it for another one. Hope that helps, and hope in time that you find it a massive benefit.